So welcome everybody to the first webinar of 2021. We're excited to be over with 2020 and into the new year. And what I thought I would talk about tonight is mare and foal nutrition. And I know that not all of us have mares and foals, and not all of us are into the breeding game. But if you're a dealer, chances are that one of your customers or clients is going to ask you a question about brood mares and foal nutrition, and it's the season for it. So I figured I would touch on it again. Now, every year around this time, we talk about it, so you can go on the DAC YouTube page and you can find webinars we've done on this topic. I'm going to try and keep this one pretty simple. You know, sometimes we get into a lot of detail and a lot of science. It can be a little overwhelming. But I want to keep this one super basic because I want you guys to be able to leave here and be able to replicate some of the things that I say. Before we start though, and I know that we've got dealers on the call that are, you know, religiously log in every month, and so you see this over and over again. But I want to start out just with a couple of tidbits on basic digestion, because you can't fix a problem unless you know how the horse is supposed to digest food. You can't feed a pregnant mare or a foal if you don't know what is normal or how the gut actually works, so that we know that, oh, we need to be feeding chelated minerals because the horse is meant to eat fiber and not rocks and those kinds of things. So we'll just touch on the basic digestion real quick, mares and foals, and then of course I want to keep it short so that we can ask any questions at the end. Now again, over and over you see this. On the left-hand side is what is a normal natural horse grazing in a field, eating a wide variety of forages. If you go again on the YouTube page and you listen to any of our webinars that we've done talking about hindgut health and the microbiome, all those bacteria that live in the hindgut of the horse, they thrive on a variety of different fiber sources. They don't just eat timothy or orchard grass or only alfalfa. They eat a wide variety of different plant types, and that's absolutely critical. They just nibble small amounts, but they do that continuously throughout the day. Horses also move when they eat. You know, they're walking around continually, and they are actually herd animals. They like being in a herd, and it can really stress them out when you put them in a stall by themselves, where they can't see other horses, they can't hear other horses. Some recent research has been done showing that if you put horses in stalls, it's ideal if that they can have an outside facing window so that they can at least see outside. That significantly decreases their stress level. And you always got to think about reproduction is a luxury. And if a horse is stressed, they're going to put all of their energy into just staying alive and maintaining themselves, and they're not going to put extra energy into getting pregnant. So if you have one of those finicky mares that's hard to get pregnant, we've got to feed her right. We've got to make sure she's in the right body condition score. We've got to make sure she's getting all the correct nutrients, but you've also got to decrease stress. I'm sure there's plenty of women on the call that know that the more stressed you are, the harder it is to get pregnant. On the right-hand side, now that horse doesn't look very stressed at all, but you know, we're either keeping horses in stalls or they're in a solitary paddock by themselves with one type of grass. We give them increased amounts of cereal grains. They consume it quickly. Some horses really stress with this lack of socialization and the lack of exercise. So we want to make sure that where possible, you have herd mates near them if they're in a paddock by themselves or if they're in a stall by themselves. And every time we're making a feeding decision, we're trying to mimic that natural grazing behavior. You know, all of the things that we do with horses, all of the feeding schedule and the types of feeds that we feed them, we do this 100% to fit into our human schedule and based on our convenience and the availability of feedstuffs in our area. But we understanding the basics of the digestive system, will help us utilize those feedstuffs to the best of our ability. So we actually start out with the teeth, and the teeth are going to grind down that food, and then it's going to get swallowed down the esophagus into the stomach, which is really small in relation to the rest of the digestive system. But acid is produced in the stomach, and that acid continues the breakdown of that food. But it can also, when we don't continually have food flowing through the digestive system or flowing, continually eating, that acid can build up and build up in the horse's stomach and get really strong and cause gastric ulcers. Again, we've talked about that in our performance horse webinars. Then we move to the small intestine. It's like a big long garden hose. There's enzymes here that break down the food. We've got sugar and starch digestion should be occurring here. We have protein, fats, minerals, and vitamins all being absorbed here. It's relatively long. It's about 70 feet in length. Looks like a garden hose, really. We know that there is an enzyme called amylase. It's responsible for breaking down starch. We know that there's not very much amylase produced in the small intestine. So that's a key to us, that if we are feeding high amounts of cereal grains, that we absolutely must be breaking them down, processing them before we feed them to our horses, so that they're easier to break down in the small intestine and be utilized and absorbed. But also, if we're having to feed large quantities of grain to maintain body weight on a broodmare, so we can get her pregnant or keep her lactating, that we need to break up those meals. 3, 4, even up to 6 meals a day will make that horse more efficient. But the other thing it will do is, research has shown that when you feed 2 meals a day, you increase the stereotypic behaviors that horses will exhibit: the weaving, the chewing, the wind sucking. So these behaviors are directly related to stress in horses. Boredom is a form of stress. And so when you see horses doing this, that's them exhibiting outward signs of stress. And again, if we want to get this mare pregnant, we've got to decrease those stress signs. So in a research setting, we might take blood from that mare and say, oh, her cortisol levels are high, and cortisol is going to interfere with reproductive hormones, etc. But you guys aren't going to be taking blood tests. How can you determine if you think your horse is stressed? You'll be looking for some of those symptoms, some of those signs. And we know that when you feed 4 to 6 meals a day instead of 2, you can significantly decrease those stereotypic behaviors, i.e. decreasing stress. We move from there, we go to the hindgut of the horse. It's made up of the cecum, the large colon, the small colon. And here it's all bacterial fermentation. It's the microbiome that we've talked about, made up of all these different types of bacteria and yeast and fungi that are fermenting all of these different fibers that are being fed to the horses, creating volatile fatty acids that will be used for energy, B vitamins, vitamin K. We also get a large amount of water absorption. This part of the digestive system makes up 65% of the digestive tract. So over half of the digestive system is the hindgut. This is the most important part of the horse's digestive system. Okay, what do we have to put into the horse's diet to feed this part of the digestive system? It's fiber. It's hay, it's pasture, it's the fibrous portion of the diet, the beet pulp. That should be the primary portion of the diet, because that is being taken up 65% of the digestive capacity. So absolutely critical, no matter what physiological stage your horse is in, that fiber is the most important part of the diet. Now, if we've got a mare in late gestation who's got a huge baby, her digestive capacity is decreased in physical size. So we need to make sure that we switch her to, if she's having trouble maintaining body weight, that we're switching her to more calorie dense sources of nutrients. So using a better quality hay in late gestation is going to help her with the calorie and protein requirements she needs for that foal. And also with the fact that there's just not a lot of room in her gut at the moment. utilizing something like the DAC digestive feed additive that is going to help promote fiber digestion, because we know she now has less digestive capacity, will also help. So pregnant mares should definitely be on the DDA. So I want to move to that mare and foal nutrition. Let's start with the mare, because without the mare, forget about the foal. We need to make sure that we've got that mare in perfect condition so that we can get her pregnant. We want her to cycle as early as we can, but we also want to have the least amount of services per pregnancy. Okay, so we only want to breed her once and get a pregnancy. We don't want to have to take her to the breeding shed 3, 4, and 5 times in order to get her pregnant. And heaven forbid if you're using frozen semen, we do not want to be wasting any of that. We want to make sure that we can get her pregnant on the first service. And so in order to do that, we know that a body condition score of 5 or a 6 is ideal. So we body condition score horses from a 1 to a 9, 1 being super emaciated and skinny, and 9 being morbidly obese. We know from human nutrition and other animal nutrition that obesity decreases pregnancy rates and fertility. So we want to make sure we've got her in that 5 or 6 category. Now, a 5 or a 6, if you're to visualize a horse like that, they've got an even coverage of fat over them. You don't really see big fat pads, but you don't see ribs, but you also don't have to press really hard over the kind of bone areas to feel those bones underneath. If a mare is too thin, then obviously that horse is going into kind of survival mode. So anywhere a body condition of really a 1 to a 4, we're going to have longer interovulatory periods. So we know that when the mare is cycling, they go through these different phases in their estrus cycle, and they have a certain amount of time for each of those. So we'll have an ovary that will develop follicles, and then one of those follicles will get large enough and it will rupture, and that's called ovulation. You know, an egg will be released and float down into the fallopian tubes. In that spot, we will form a corpus luteum, and that corpus luteum will then produce progesterone, and that progesterone will help to maintain that pregnancy, the early phases of that pregnancy. But if we don't have fertilization of that egg, then the corpus luteum will regress and we'll start the whole cycle again. So what we need to make sure is that that corpus luteum, if the mare is not pregnant, that corpus luteum will actually regress and the follicular cycle can start again. But what we find is that with thin or fat mares, that corpus luteum does not regress and it continues to maintain producing progesterone. And so we have these really long, what we call interovulatory periods between ovulation, between that follicle rupture, and that's wasting time and money. So we get decreased conception rates, decreased pregnancy maintenance. So maybe you get this thin mare pregnant, but she can't maintain that pregnancy. And so if she's losing weight, that is a real problem. If you get her pregnant and she's between a 2 and a 4, and we can catch that in time and really get her to start gaining some weight, then we might have a much better chance of maintaining that pregnancy. But if she's losing weight in the early stages of pregnancy, she's definitely going to abort that embryo. Being obese has its own set of complications. Insulin resistance, high insulin, is associated with impaired oocyte quality. Now, for those of you that have been on the webinars, we've talked about insulin resistance. You know, when you eat food, it gets broken down into glucose, and that glucose needs to get out of the bloodstream. It gets absorbed into the bloodstream, but in order to get out of the bloodstream and into the tissue to be utilized, it needs help to get out of that blood. And the pancreas will secrete, it will sense that there's a lot of glucose floating around, and it will secrete insulin. and insulin will flood to the area, and it will attach to an insulin receptor, which is like putting a key in a lock, and it will unlock that channel. So now the glucose receptor will open and allow that glucose to flow freely out of the blood and into the cell. If an animal is insulin resistant, the insulin will be secreted, but the insulin receptor is broken. So all this insulin will just be sitting in the bloodstream along with high amounts of glucose because it's got nowhere to go. That high insulin that's got nowhere to go, that keeps getting produced because the pancreas keeps seeing that there is excess glucose, that will actually impair oocyte quality. It will it will decrease the function of the corpus luteum. If you get the mare pregnant, it decreases fetal growth. And we know from human and livestock nutrition that it's this concept called fetal programming, that we know that whatever that mare is eating and whatever kind of biochemical environment she has created for that fetus, it can predispose that fetus and then embryo then fetus to diseases later on in life. In humans, we see early onset of puberty. In horses, we can predispose them to growth disorders like OCD. So a mare in early gestation. So we've got her in the right body condition score. We've gotten her pregnant. In early gestation, she really doesn't have elevated requirements as far as vitamins and minerals and protein and energy. But that doesn't mean that we can neglect her mineral requirements. The minerals are absolutely critical at that stage of pregnancy for early embryonic development. This is a time where we can adjust her body condition score. If we need to increase it, we can. I am always cautious if I have an overweight mare of decreasing body condition in the first trimester. I'll usually wait till the second trimester. We can continue doing exercise throughout pregnancy, but I am always cautious in the first trimester because early embryonic loss is such a big problem in horses. So I usually wait till the second trimester to try and curb obesity. We can start to do it in the first trimester, but we don't really get right into it until the second trimester. But if we want to increase body weight, we can certainly start doing that in the first trimester. So if you used something like the DAC Orange in your program, she wasn't difficult to get pregnant, then you can maintain her on the DAC Orange all the way through pregnancy. She would be eating a maintenance, 1.5 to 2% of her body weight in hay, and maybe you're feeding a small amount of oats or a larger amount of oats if she needs extra calories, or maybe you're feeding a commercial grain. In the middle of gestation, we're looking from months 7 and 8. We definitely start to see an increase in energy and protein requirements here, increase in calcium and phosphorus requirements. We start to think about what can we feed that mare to improve her immune status. We also start to think about how can we start to make sure this mare has the correct type of minerals that are going to be the most bioavailable. So chelated minerals are more bioavailable. They're organic forms. So the easiest way to describe this to your clients is this is the form, the organic form is how they would see them when they were eating organic natural food ingredients like grass or hay. The sulfated or inorganic trace minerals are literally dirt, and we know that horses don't just typically eat dirt, and those minerals are not in a form that are super bioavailable. We know in this pregnant mare we want to make sure that these minerals are bioavailable because she's going to start fortifying that fetal liver, and we're building the foundation to your foal. So absolutely critical that whatever you're feeding has these organic or chelated minerals. All of the DAC supplements absolutely do. In the 9th, 10th, and 11th month of pregnancy, we're talking about late gestation. Again, we're further increasing protein and energy because she's laying down a lot of tissue and fat in this foal. Also, absolutely critical at this point. We do have an increased amount of vitamins and minerals required because at this point she's fortifying that fetal liver. So mare's milk isn't really high in mineral content, but she is going to overcome that by putting the minerals, so she's absorbing minerals out of the food that we're feeding her, and she's using whatever she needs for herself, but she's also then taking some and putting it into that fetus's liver so that it can draw on those once it's born. So it's absolutely critical that we continue to feed really bioavailable sources of minerals throughout late gestation. And you can see here, I talk about energy and protein requirements and how really in that first trimester they are about the same as a horse at maintenance. And you can see here that protein and energy, so protein being the red line and energy being the blue line, they're pretty stagnant for the first 4 months. They stay pretty stable, and that's the same as a maintenance horse. Then right around that 5-month mark, we start to see an increase in protein and energy requirements. And you can see it's pretty steep during the 9th, 10th, and 11th month because again, we're laying down tissue and fat, and that is what she's going to use to lay down that tissue and fat, and that foal is the protein and energy. Oops. So if we now switch to early lactation, okay, we've had the foal, we've fed the mare accordingly, we've got a great healthy foal on the ground. Months 1, 2, and 3 are the highest requirement for protein and energy out of any class of horse ever. There's just no other horse that will have higher requirements for energy and protein. It wouldn't matter if you're a Kentucky Derby winner. You do not have higher energy and protein requirements than an early lactating mare. Do not underfeed her at this point. Now, there's also been some questions I've been answering lately about, I've got a mare, she just doesn't seem to be producing a lot of milk. Is there a supplement that we can add to help her produce milk? And yes, there actually is. And this is a lot of dairy research where this first came up, but it sounds a little weird that the mare doesn't necessarily have any metabolic issues, but the product that we have is the DAC metabolic because the DAC metabolic has chromium in it. The chromium helps with the insulin resistant horse, but it also, remember, for the performance horse, and this is the ultimate performance horse right here, it can unlock more glucose to be utilized by that animal. How do you think a mare makes milk? She uses glucose. And if we can unlock more glucose, she can make more milk. So a lot of the research has actually suggested that for 2 months prior to parturition, to foaling, that you would feed a chromium source, and then obviously throughout that early lactation period. But if you've got mares with foals hitting the ground now and you're just concerned about the milk quantity, you can certainly just start feeding it now. You can see in early lactation, months 1 and 2, we've really got the highest requirement for protein and energy. If you have your mare on a grass hay, let's say she's eating grass hay, oats, DAC, orange, during her pregnancy, that is not going to be enough protein to support early lactation. You're going to have to switch her, add alfalfa to the diet, maybe adding a fortified feed that's got more protein in it because the grass hay just isn't going to cut it. And certainly the oats are not a source of protein, and certainly not a good quality source of protein. So this is a time where we need to be adding in alfalfa to the diet if you're really trying to stick with a clean, simple diet. But you can see right around month 3, the protein and energy requirements for that mare significantly drop off. And so going back to a more maintenance diet is easier at that point. Let's look at what's actually happening in the fall. So we talked about the mare throughout pregnancy, throughout early and late lactation, and how we should be feeding her. But what are we actually feeding in utero? Less than 6 months is what we call early gestation, and really those first 40 days are absolutely critical when it comes to embryonic loss. So in the first parts of pregnancy, I'm really, like I said, not concerned about changing her body condition if she's a little overweight. If you look at these images, you can see that we have some pretty significant organs being developed in the first 40 days. The heart is already starting to be developed by about 18 to 20 days. We can see a heartbeat. We know that zinc, copper, vitamin A, and vitamin D are absolutely critical for heart function, heart development. We've got a lot of blood vessels in here. We're starting to see a tail bump, eye bump. The other thing that it's not a necessary nutrient. It's not essential per se for every pregnant mare, but it's certainly something that has been added as an essential nutrient for pregnant women, and that's the omega-3 fatty acid DHA. We know that brain, eye development, nervous system development are all enhanced when an animal has sufficient amounts of DHA. So DHA perform can be added to the diet of a pregnant mare, and that's going to flow through into that fetus and into the development of that fetus, and I think significantly improve the quality of that fetus. Oops. You can see as we move from, say, about day 50 all the way through to 5 months in that early gestation here, you can see significant, by 5 months, we've really got all the limbs and developed. We've got hair, eyelashes, hoof development, male and female development. So a lot is going on in those early phases. Even though it's so small, we've got such critical organs being developed already. So in mid-gestation, that 7 to 8th month period, we said that energy and protein is increasing. We've got about 90 grams a day of fetal growth, so not a huge amount, but it's starting to grow. But you can see here in this chart, the liver, the heart, the kidney, brain, lung, bone starting, well, it's really cartilage, all starting to be developed. And you can see the minerals, iron and selenium and copper and zinc, all absolutely critical. Vitamin A, vitamin D, B vitamins, really, really critical. Vitamin E, C, critical for that foal, developing that sound structure. You know, once your foal is born, you've already built it. You're building it in utero. So feeding the foal is the most critical when it's still in utero and you can't see it. That's when it has the most flexibility. You can do the most good and the most damage. At about day 24, this equine embryo is about the size of a pea. By day 7 8, it's about the size of a small beagle. So we're still really small, but you can see the significant amount of growth that occurs between those two time points. Now, in late gestation, we're looking at that 9th, 10th, and 11th month. We go from 90 grams a day to 500 grams a day. Okay, so we're, quadrupling the amount of growth per day. Half a kilo a day is about a pound of growth per day. We are gaining 80% of that horse's body weight, that foal's body weight, in those 9th, 10th, and 11th month. We're fortifying that fetal liver stores. Mare has increased energy and protein requirements because we're laying down so much tissue, muscle, and fat. So when do we really need to start feeding this foal? It's born, it's healthy. When do we start feeding it? Well, we go back to that milk lactation curve that I showed you earlier, and you look at when does the milk production really start to drop off, and it really starts to drop off between that 2nd and 3rd month. And so I usually say right around month 3, we want to make sure that we've introduced food to that foal, that it's going to get its own portion, whether that be it's eating some colt grower out of your hand, it's eating some of its mare's food. If you have a foal that has developed any kind of growth abnormality, you actually want to start feeding it as early as 30 days of age. We know that the mare, in those early days, that mare's milk is the primary nutrient source, along with the fetal liver stores. Peak milk production is prior to 3 months, and then it really starts to drop off. You can see from this kind of chart here in red that right when the energy requirements of that foal are really ramping up, that's when milk production starts to really decrease. So we want to make sure that they're eating hay, they're getting their own minerals, because a lot of times people will get concerned about the energy and the protein that the foal is eating, and it's growing too quickly and it's causing developmental orthopedic disease. And really you can see here that the energy requirement increases. The foal is growing rapidly, so you absolutely just need to support that growth. How do you support that growth? With minerals. So it's really, really critical that that young foal has been fortified during its time in utero, but then also once it's born, that we make sure that it's after month 3, it's really used up all those liver stores, and you need to make sure that you're getting those in its diet externally. We know that developmental orthopedic disease is the one thing with young growing foals that we all freak out about. It's an umbrella term that encompasses all different OCDs, angular limb deformities, wobbler syndrome, fasciitis. So all of these kind of come under that developmental orthopedic disease heading. And we know that genetics play a huge role. We know that nutrition plays a huge role. We know that disease, injury, all of these contribute to the incidence of DOD. When it comes to nutrition, it's excess energy, but it's really excess energy in the presence of a lack of protein and a lack of vitamins and minerals to support that growth that is going on. We know copper deficiency coupled with excess zinc or an uneven balance of copper and zinc, an uneven calcium to phosphorus ratio. We know in the young growing horse, of course, 2-to-1 calcium to phosphorus is ideal. We can get up as high as 3-to-1, 4-to-1 in a young growing foal, but we really don't want to go any higher than that. In a mature horse, you can go as high as 5 parts calcium to 1 part phosphorus, but in a young growing horse, that's not ideal. And also the lack of selenium, because selenium is really important for the immune function. We know these foals are born with no immune function really. Whatever they're getting from whatever's passing across that placental barrier. So again, we see that moss, which is in the DAC digestive feed additive, adding moss to the diet of pregnant mares can actually significantly increase the immune function of those foals born to those mares. So further making the case for these mares to be not only getting a balanced vitamin and mineral, but also getting a probiotic that contains yeast and moss. So when we have these foals that might have some of these developmental orthopedic diseases, the treatment, it's multifactorial treatment. We're going to wean the foal. I will wean a foal as early as 3 months of age if I have to. You may reduce the amount of energy to, I have the word slow growth there. You're really not going to slow the horse's growth, but you can decrease the amount of body weight that's putting a lot of pressure on those joints. We need to analyze the diet and make sure that they're getting all of the relevant minerals that they need, stall rest to prevent further damage, but that's a double-edged sword, because we know that exercise helps to lay down calcium in the bone and strengthen bones. So we want to make sure that we're not completely cutting off exercise, but if there's swelling and fever and pain, that we're decreasing their exercise load. And then obviously your mares throughout pregnancy are going to be on something like the DAC Orange, the Breeder's Choice Plus, either one of those, not both of those. And also, if your mares have access to the DAC Lick Tub, and then you're also adding the DAC Orange or the Breeder's Choice Plus, I would recommend you probably take the lick tub away while they're getting the DAC Orange and the Breeder's Choice Plus. It would just be overkill. We wouldn't want to unbalance those vitamin mineral profiles. The young growing foals, the colt grower as early as 30 days of age if we're concerned about growth abnormalities, but at least by 3 months of age they should be adjusted to the colt grower. Again, as early once they're born, as soon as you see symptoms of DOD, we can start doing the CMZ paste according to the label's directions. And if we need to increase milk production in the mare, we can use something like the DAC Metabolic because of the chromium. It's more cost effective for our clients to use that than something like the eBoost paste. So I wanted to keep it short. I wanted to keep it more simple than some of our other foal/mare talks. Any questions that you have, I entertain them now.